It is my absolute pleasure and honor to have you all with us. Good morning, good afternoon, good evening, as per the regions from where you are watching us today. And see, this development which we are facing on everyday basis, everyday growth and scaling up our own skills on everyday basis is something which is beyond the expectations and which is happening on everyday basis. I would like to welcome Dr. Aatir, who is the speaker of the day. And Dr. Aatir, I request you to please stop sharing for a while so that I may share your introductory picture first. Thank you very much. So Dr. Aatir is the first speaker of day 3 of Bootcamp, and he is a consultant psychiatrist and psychotherapist, senior registrar at Department of Psychiatry and Behavioral Sciences, LUMS. Thank you very much, Dr. Aatir, for joining us today. And this is the third time that Dr. Aatir is sparing his time and he's participating in the training sessions which are happening at the platform of Bootcamp. And the reason of this is, again, like-mindedness, because Dr. Aatir also aims to educate the teachers, educate the people who really prepare the heralds of the future for the upcoming days. I mean, with 2040 vision, what we want to see in the world, and we need to deliver that right away from today as we believe it here at the platform of PPDCI. So Dr. Aatir shares the same aim and the same goal. That is why he is very well associated with us. Dr. Aatir, I'm really very grateful. Thank you very much for joining us today once again. The ground is yours.
Thank you, Ms. Chana. Thank you for introducing me. Hello, everybody. I hope my voice is clear to you. And as the introduction is being done, so let me start my presentation. Ms. Chana, is
yes, visible.
It's visible.
Your presentation is visible and your voice is very audible. Thank you very much.
Thank you. Okay. So, ladies and gentlemen, I start with the holy name of Allah. As Ms. Hina has just introduced me, I am Dr. Aatir Hanif. I'm a psychiatrist, a psychotherapist, a psychologist, and a medical health professional educationist. So I'm also by profession a teacher. In fact, I am still learning to be a teacher. That's why I have very much passionate about doing activities which may increase the capacity, which may enhance the capacity of the students and the teachers. So one of the things that I would like to tell myself that I am a clinical fellow of child and adolescent psychiatry as well. Recently, I have started that, and I'm currently serving as senior registrar and deputy director for Center for Wellbeing for Students at Liaquat University of Medical Health Sciences, Jamshedpur. And today we will be talking about learning difficulties and antidotes. Before the formally start of my presentation or the talk, I would sincerely extend my gratitude towards PPDC organization, who is providing such a excellent opportunities to the listeners and the viewers to enhance their capabilities regarding the education system. So technically, when we speak about learning, there we usually think of formal learning or classroom learning. Well, learning itself is a process. It is defined as a process in which our behavior changes in response to a certain experiences. So whatever we do from the day one we come into this world, we experiences a lot of things which are being taught by the environment. Sometimes we are involved in this learning. whether this learning is about language, this learning is about writing things, this learning is about certain behaviors that may be religious, that may be social, that may be academic. So all these of experiences, all these of these experiences led us to a modification in our behavior, and that is called learning. Learning is a process which we have every day, every single moment of life. We usually think about learning, we usually consider it as confined to the classrooms only, but learning has very vast application. This process is literally anything and everything a person goes through his life is comes under this umbrella of learning. So the purpose of me teaching to discussing this concept of learning is about to give you a clear-cut idea about difficulties and the disabilities that one encounter during clinical practice and during everyday practice while engaging with the students. So first of all, we need to understand that when we talk about learning, it is not only about academic or professional learning. It will encompass everything, every behavior that we usually encounter, that a human does in his whole life. So for sake of simplicity, learning is divided into two broad definitions. One category is formal learning, in which a person learns through a specific dedicated methods, and it follows a specific you can say that structure. So by formal learning, we means learning of today's conventional teacher conventional teachers learning, that is like classroom learning. So it has a type of social learning, that is the classroom teaching, and you have individual formal learning styles, which is like mentoring or tutoring, it where the learning is one-to-one. There is a teacher and it will directly teaches to his or her students. While in social or classroom learning, there are more than it is more than an individual or mentoring or tutoring type learning, because there are peer learning is involved, observational learning is involved. One learns through his behavior, his classmates and the system as well. And the other learning is informal learning. Informal learning, again, it is of two types: social learning and individual learning. So social informal learning is what we learn through our society and environment, that includes our principles of morality, our behavior, our civic sense, our manners. These all are informal social learning, which we these are the traits or the behaviors that we acquire through the society. And then there are some kind of other individual informal learning, which is a kind of reading or going surfing through the different sort of information by yourself without a dedicated or following a structure system. So this manner, the learning is divided into formal and informal learning. While now, as in 21st century, the education has become a specialized subject, and it is mostly, as of our common perception, it is mostly confined to the classrooms or professional education systems. So we will be majorly discussing the learning difficulties and the solutions to it by keeping our focus towards or specifically on formal learning styles. So my focus would be today of about the formal learning styles, but we need to keep in mind that whatever difficulties a person is facing in formal learning, that may have its impact on informal learning as well. And by informal learning, because one can easily understand by this that the formal learning is something that makes you educated, makes you like uh, a successful person, or it helps you to achieve a certain goal in kinds of job or academic career. While informal learning is that component of the learning which makes you a human, which makes you a social animal. It makes you a person who has certain behaviors, responsibilities, ethics, and is all the traits of a good human. So whatever, if there is a difficulties in any part of the learning, whether it be the formal one, that can be tolerable. But if the problems are in formal learning, they have much more damaging effect than the formal one. While formal learning difficulties are easy to be uh, found out, or easy to be diagnosed, informal learning difficulties are very difficult to find out. So a common question, that are there learning difficulties in children? Do we have learning difficulties in children? The answer is yes. I would not know how many of you have encountered such children who have learning disabilities. I'm focusing on the word learning disability. I don't know how many of you have encountered that, but learning difficulties in children is very high. It is there are two different things that I would like to clarify at this stage as well. uh, Learning disabilities are those disabilities in which the problem is in your mind, and it's a neurological problem, that a person is unable to do a specific learning task, whether he won't be able to write, he won't be able to read things, he would not be able to plan, or his executional function would be decreased. And there are other learning difficulties. Learning difficulties incorporates like issues of attention, issues of concentration, difficulty engaging in friendships or social interaction. So there are two different types. The one is a disability and the other one is a difficulty. So learning disabilities are severe. They are more common. They many times they have collateral intelligence disability as well. If a person is having a learning disability, there is a strong chance he or she will be having low intelligence or low IQ as well. And it is said that one in the 60 children in US has severe learning disability. uh, Estimated learning disabilities worldwide, global range is 5 to 9%. So 5 to 9% of the all children faces or experiences one or another kind of learning disabilities. So if you think it is like, if you consider it as there are people of 100, out of 100 there are 9 children, out of 1,000 there are 90, out of 10,000 there are 900, and out of 9 million there are 9,000. Or out of 1 million there would be 9,000 or 90,000. And that huge burden of children having learning disabilities is astonishing, and that is very grave. We need to understand, and the facts that I am sharing is of developed countries like USA and the global stats, while in countries like Pakistan we don't have accurate data regarding childhood learning disabilities, or even child or adolescent learning difficulties. We not have data on the learning disabilities, neither on learning disabilities. So this huge potential, this huge burden of diseases causes we to wonder, do we need to identify these learning disabilities? If yes, do we need to understand the impact of it? If yes, we need to identify them, we need to understand the impact, then there will be the reason, that would be the sole reason of this whole exercise, is that we should understand the importance of it, And when we understand the importance of childhood learning disabilities, we came to know the impact of it on his whole life, a person's whole life. And then, and only then, we will take it seriously to understand the signs and symptoms of certain disabilities, learning disabilities. And we focus ourselves on identification of such learning difficulties which may hamper the child's growth and in education sector. So I've just discussed the concept of learning disability and learning difficulty. There are words somewhere are used synonymously, but learning disabilities are those disabilities which are neurological in nature, which are still further divided into two types of disability. Number one is developmental disabilities, and number two is specific learning disabilities. While learning difficulty is something that is not neurological in origin, it is secondary to psychological or mental health issues. Like a person has anxiety or a person has depression or OCD, he or she may experience difficulty in concentration, issues of attention as well. Now, this learning difficulty, this issues of attention and concentration will result in the learning difficulty that a person's functionality towards learning content would be decreased. And this would result in a learning difficulty. So this learning difficulty is secondary to a psychological problem or a stress, even a stress. While this learning disability is a disease which is either developmental, which is either by birth or neurological. A child born with the learning disability, number one, which is mostly which is either a global intellectual disability, means the person would have a low IQ in almost all areas of his life, almost all. Like Down syndrome, the person has low IQ, like mental retardation, the old term for the intellectual disability. So global intellectual disability, number one, or either a specific learning disability in which a person has only a person is unable to do one specific task. Like he would not be able to write, he would not be able to understand the written stuff, he would not be able to calculate, or his math would be very weak. So these are the specific learning disabilities. So number one is global intellectual learning disability, which have low IQ, low performance in all segments of education, even in the social context or interaction. Number two, specific learning disability, which will have impact on one domain of educational learning, formal learning. And number three is a developmental disability. Developmental disability is a neuropsychological, neurological and psychological, both a combined disorder, which have it's basically a neuropsychological disorder, but have impact in more than one domain. So these on the screen, these are some learning disabilities and developmental disabilities have been shown. For example, the developmental disability is attention deficit hyperactivity disorder. So attention deficit hyperactivity disorders accompanies, it has three major symptoms. Number one is symptoms of inattention, means a person or the child is unable to be attentive for a sustained period. His or the attention span would last for like 5 seconds, 10 seconds, 15 seconds. Moreover, this symptoms of inattention, lack of attention, accompanies with hyperactivity and impulsivity. So you find these type of children who will not be able to sit on a chair for even for a 30 seconds or 1 minute. They try to move or try to touch anything other. They try to just leave their place, try to stand up, or does some impulsive acts. They may get hold of any pen or marker or anything that is being placed in front of them, and they can throw it or take it into their mouth. So these are the signs of the impulsivity as well. So there in ADHD, there are symptoms of inattention accompanied with symptoms of impulsivity and hyperactivity. So these three symptoms would cause significant impairment in their homework. They are unable to do their homework. Because they are unable to sit for long. They would not seriously take classes, or they are unable to note down homework in the class. They are unable to uh, focus on the teacher's teaching. So the most of the problem in their classroom activity is about moving them around too much, unable to sit, and not able to work properly or note down their work. Then one of the other disability is autism spectrum disorder. Autism spectrum disorder, the primary there are two major components in terms of learning. One is, in autism spectrum disorder, language is delayed. Means the language is not developed on the right time. It may develop after a while. Means the child starts to properly speak like at the age of 6, 7 or more, while usually he or a child should be speaking by 3, mostly by 2 or 3. That is the age limit at which the normal language should be developed. But in autism spectrum disorder, the language development is delayed. Second, the most important component in autism spectrum disorder is disturbances or significant impairment in social learning. Autism spectrum disorder is a problem primarily of communication. That is why it has one component of verbal communication. Second is even non-verbal communication as well. Autistic children, the children with autism or autism spectrum disorders, have difficulty in establishing and maintaining relationships. Even with the parents, they don't have a strong emotional bond or connection with their parents as well. So they won't have emotional bonds with their teacher, not with their students, not there with friends or the peers, classmates, who are the most important source of learning. So because the social interaction element or social learning element is dampened or hampered in autism spectrum disorders, there is a significant discount as a significant disability. And then central auditory processing disorder means the child is, this does not mean the child is deaf. Child does not have hearing loss. He or she can listen, but the sounds that we understand with the help of our childhood learning, the concept of the reception in our central auditory system, nerves, that sound is misinterpreted by in this disorder. So if I would say hello to a child with having CAPD, he will understand I am yelling on him, or he will understand like get out or something. So words sound different to them, words have different meaning to them. So with this disorder, the entire system of communication or expressing your thoughts to other person would be disturbed, and that significantly hampers the learning process. So these are the developmental disability. One is lack of attention accompanied by inability to sit and focus. That causes, if the person has that would not be able to formally we will not be able to formally educate him. While if the person has lack of emotional understanding, difficulty in communication, and lack of social learning skills, that would also hamper, that would not be educated in a conventional system. No? They would be requiring a separate education system or individual educational supervision and planning. And then for the third, if the message is wrongly conveyed or misinterpreted by other person, so the communication system, our communication is failed, and the child will not be able to get proper education in conventional education system. So these are the developmental disabilities. Now coming to the specific learning disabilities, which are mostly in one, dyslexia. It's a kind of learning disability in which a child is unable to read and spell well. They would be having difficulty in reading and understanding. Number one, dysgraphia. So dyslexic child can write, can do math, can do visual arts or the painting, but he would not be able to read stuff properly. So I can relate an example. We a couple of years ago we had there was a Bollywood movie, Tare Zameen Par, and there was a character which was dyslexic. So there is a very good video. If you can search it on YouTube, you will find that a child, that the main child actor, he will be studying from a book, and there was letters flying from the book. He is not able to understand or grab the meaning out of it. So that is basically the dyslexia. It is the disability of reading and spelling. Then there is a disability of dysgraphia. The child may read, but he would not be able to write properly. He will find difficulty in words which are similar, written similarly, like B, small b and small d. Both are written, they are mirror letters. So they would have difficulty in writing those. A child would be unable to write it and if. He will not be able to differentiate between them. It, it, I small, t small, and if, I small, f small. So f or t would be difficult to distinguish in this with the child having these cases. And then the third is dyscalculia. Dyscalculia is inability to perform math calculations. Now the people argue that dyscalculia is basically not the disability. Many of the children do feel difficulty in like mathematics, or they are not understand about they don't understand or they don't like math at all. But the thing is, it will be different or distinguished. It can be distinguished from the you can say that non-interested in mathematics or dislikeness towards mathematics, that if you don't like mathematics, you can still do basic algebraic or basic mathematical operations like multiplication, subtraction, division, addition. You can even do these type of simple mathematics, even if you dislike it. These type of simple mathematic operations, which usually or normally we use in our daily life. So if I don't like mathematics, I would still be able to do these kind of simple mathematic operations. But if a child who has a disability, he even won't be able to do simple calculation. 2-digit multiplication would be very much difficult for that child. 2-digit or 3-digit addition would be very difficult. So now what we do in conventional education system, when we give homework to the students, I'm talking about in Pakistan, the practices that being followed in Pakistan, that normally we provide homework to the students, or either we are supervising students about their work. What happened if a child is unable to do basic math calculations? Even the rest of the his batch mates or his age mates can do that, but he is not able to do simple mathematical calculations. We think that the child is does not want to do that or is not interested, and we deal with them with punishment. While the basic problem lies that most of them have may have this kind of disability, which we need to understand or explore. So dyslexia is a type of specific learning disability in which there are issues related to writing and understanding of in writing and comprehension level issues. So dyslexia, the word itself is a Greek origin. It is called as impaired. The term meaning is impairment. So dyslexia is a specific learning disorder that is basically neurobiological in origin and is characterized by difficulty with inaccurate word recognition, poor spelling, and decoding abilities. Dyslexic children struggle with reading comprehension. They many times they also accompanied with delayed speech. They have difficulty learning auditory processing disorder. New vocabulary or rhyming are difficult to them. They many times have visual processing disturbances that I just told that there would be the differences. They would not be able to differentiate between b, small b, and small d. So these are the difficulties that the children with dyslexia usually encounters. Moreover, this dyslexia disease significantly affects spelling, copy pasting, proofreading, and comprehension abilities of a child. And this would significantly impair their learning abilities. Now, second one is dyscalculia, that I already told that people with dyscalculia have difficulty understanding math concepts. I'm not saying difficulty in understanding complex issues like algebra, geometry, trigonometry, but they have difficulty with basic arithmetic operations, addition, subtraction. They would not be able to properly deal with these basic arithmetic basic arithmetic operations, and that would leading to difficulty with more complex skills. These students struggle with mathematical concepts such as measuring time, estimating time estimation. They are unable or unsure about how to do basic math problems. They have difficulty in grouping or in counting stuff. They are and the most important problem, they in their normal life, in their informal learning domain is concerned, they also have issues of orderliness, means they won't be usually follow a specific orders. If there are something with a certain sequence or strategy.
Dr. Aatir, I think there is some technical glitch. We cannot hear you at this moment. All right, ladies and gentlemen, give me a minute so that I may coordinate with Dr. Aatir. Perhaps there is some technical glitch at his end. That's why he is disconnected. See, it's a blessing to be connected globally through these virtual mediums, but then these technical glitches are part and parcel of this life which we are living. So spare us for a moment. Meanwhile, you can share your feedback so far, the learning ideas. If you need to ask something, if you want us to scaffold any idea, you can write here in the chat room. I'm getting connected with Dr. Aatir meanwhile.
Is very shared.
Welcome back, Dr. Aatir.
Okay, I'm sorry there was a power cut at my region.
I understand. I understand.
So We were talking about dyspraxia. Dyspraxia is a disorder. It's a neurological disorders of basically coordination issues. The children or the people with dyslexia has issues in coordination. They are unable to perform the task which requires fine motor skills like painting, drawing. These kind of disorder, this kind of problems are very much common in children with dyspraxia. It is sometimes often referred as developmental coordination disorder. It cannot only be diagnosed only in the medical via medical assessment. The assessment is done on both parameters, on both domains, medical and educational and education. Dyspraxia for assessment of dyspraxia, it involves significant time and energy to not only have a view about body physiological functioning, but also with the educational assessment tools are used. And these problems, this would not causes problem or in all domains of life or learning, but it significantly hinders certain areas of learning. Moreover, the other is executive functioning issues. So what we were talking about, there were three specific learning disorders that we talked. Uh, Sorry, one is remaining, dysgraphia. So dysgraphia is a problem in which it mostly exhibits by poor spelling, poor handwriting, and trouble putting thoughts on words. Expressive verbal uh, uh, verbal content of expression that deals with our Broca's area, that is significantly hampered in neurological disorders which are dysgraphic in nature. So dysgraphia is caused by the variety of the factors. They may be caused by people who experiences cerebrovascular accidents or the strokes at the lower premotor areas in the in brain, or have a traumatic brain injury. Sometimes they do experiences dysgraphia, so they have difficulty in writing things. Their handwriting are messy or become messy. They take very long time to write or convey their express their ideas on the paper. They also have difficulty in organizing papers, chapters, or books. So anything which has a certain graphical representation or expression, written expression, they would be they would find difficulties in that. So we have specific learning disorders like the most common is dyslexia, then dyscalculia, dysgraphia, dyspraxia, which is mostly of the motor control problems or practical. This hampers the practical learning element. Now there are certain other problems which comes under the heading of the learning difficulties. That is executive functioning issues. Executive functions are those functions which are called higher mental functions. These are planning, planning regarding any specific event. Even you are like from playing chess to planning for your finances, planning for your like scheduling your week, prioritization, time management. These all are the executive functions that a human do. And when uh, people have difficulties, they many times they have difficulties in executive function. So you may encounter persons in your daily life uh, that are who are doing very fine in their education segment. They are living normal, healthy lives, but they have certain you can say that certain difficulties with planning and proper prioritization. They are not able to prioritize their life events or their specific tasks. They are not able to prioritize them, and that is again a disturbance or difficulty of learning the process. Informal learning process has this kind of executive functioning problems. Moreover, there are, as I have told, there are issues of social interaction and social learning. If the issue with social learning and social interaction is in the childhood, that is more likely to be autism. I have already discussed about it, that in childhood it would most likely to be autism. While if a person's childhood learning experience is very fine, the child was appropriately educated and does not have any kind of social interaction problems. But when he grows into adulthood, he develops certain disturbances or difficulties in social interaction that may be due to social anxiety. So social anxiety is another common neurotic or anxiety disorder in which students are unable to talk in front of a small group. Even they cannot talk or express their ideas in front of 3 or 4 people, less alone they can deliver presentations or debate. They can do debates. So this significant there is a significant impairment in learning domains, especially of the social learning domains, and that is caused by the social anxiety disorder. Then we have specific learning issues, issues of attention and concentration. Again, these are the very common issues, mostly as I work in a center for well-being at a medical university. So I usually encounter the students from first year MBBS or BDS in their university life, from first year to final year, and 95% of the students are having difficulties in focusing on their studies, have difficulties in concentration. This is the most common, most prevalent issue of today's children, that they have difficulty in issues of attention and concentration. What people usually discuss about that, they have the habit of daydreaming. They have habit of overthinking on different elements, and they usually follow the stream of thoughts. Now, again, I'm talking about, we will be focusing on two age groups. Number one is childhood, another one is adolescence or adulthood. In childhood, if there are issues of attention and concentration, we need to focus or explore the other areas, other domains as well, which are the child hyperactivity or impulsivity. If a child is having issues in attention, concentration, that is more likely to be ADHD. But if an adult is having issues with attention, concentration, daydreaming, overthinking, he or she may have issues of anxiety or depression. Adult ADHD is very much underdiagnosed. Usually, not many psychiatrists or not many mental health professionals diagnose people with adult ADHD, because when it comes to the prevalence of certain disease or the burden of certain disease, anxiety and depression is very much common in adolescence or adulthood. It is it is like 60 times more common, 60 times more prevalence than it has adult ADHD. It has many of the risk factors than the adult ADHD. So it is mostly adult ADHD is underdiagnosed, and mostly when we have disturbance in the concentration, in adulthood, which have recently been developed. So we label it as anxiety or depression. Or sometimes in my practice that I found that uh, the most widely found culprit of disturbances in attention and concentration and focus is obsessional thinking. Obsessional thinking can maybe under depression during anxiety, generalized anxiety as well, and it may be due to obsessive compulsive disorder. So obsessional thinking is one of the factor which most, in my view, according to my practice, has significant impairs significantly on attention and concentration. So what happened when if a child has either specific learning disability, then he or she must be taught in a separate way in a non-conventional teaching environment, and he should be tutored or mentored, not individually taught, not taught in a classroom. So we have special schools and individualized educational programs for such children, which who are having developmental disability like ADHD, ASD. If a child is having specific learning disability, means he has disability in only one of the learning domain, either in mathematics calculations or in reading or writing. So he or she may uh, be taught in same conventional classroom with other children, but the specific learning disorder should be focused separately as well. Children uh, should be focused or should be supported by the teachers in their areas of disturbances or decreased functionality. And if adolescents or adults or the children are having disturbances in executive functioning, prioritization, issues of attention and concentration, or social interaction secondary to social anxiety or depression, then he or she should be referred to a professional, mental professional, and they should work on their mental well-being. So we have three different types of disorders or learning difficulties. One is developmental disability, which for which we need to have a specialist on board, a mental health professional, not a single mental health profession, a team of mental health professions, occupational therapists, physiotherapists, special educators, speech therapists, psychologists. So we need all of these to work combinedly to deal with this developmental disability and on individual level. And if a child has a specific learning disability, then now he can be taught in the same school, same classroom by the conventional teachers, but the specific disability should be supported by the teacher or especially specializedly trained teachers, preferably with the help of educational psychologists. And now that the third thing is, if an adolescent or child has developed learning difficulties secondary to the mental health issues, the child or the adolescent should consult a mental health profession on individual level. First, he or she have to make certain changes in their lifestyle, so minimize the effect of these mental health disturbances. He or she needs to manage his sleep and his stress, and then if he is not able to gain benefit from the self-help, he may consult a mental health profession. And apart from professional consultation, certain things when one can do is to manage his stress, because stress is basically the name of disbalance, a state of disharmony. So it is said that there is a place for everything, and everything if everything is in its place, there will not be any stress. And we all know that where things goes beyond the limit, if we do everything, whether it's education, finance, working, sleep, everything in its limit in a balanced state, we will not be feeling much distress. Talking about the antidotes, the primary solution, the most important solution is knowing the problem. If you know the problem, then you can accurately find the solution. And again, what I have I've been talking in my this talk, that there are several different types of disabilities and difficulty. Some are development ones, some are specific one, and some are certain specific difficulties that person encounters, and the solution varies according to the problem. So what you can do is you can know and understand the problem, and with by the help of if you identify the problem, then you will be able to solve it and appropriately consult someone. For talking for thinking about your own learning difficulties or disability, or about learning difficulties of your loved ones, be insightful. Be insightful about yourself and about people who are surrounding to you. Talk to someone if you find these kind of problems, and if you think you are unable to deal with these problems yourself, then seek help. Seek help professionally before this matter aggregates and would result in significant decline of your functionality. So with that, I would like to conclude the talk, and it's a brief message. Please keep calm, be positive, take it easy. It's life, have fun. Thank you, Ms. Sinha.
An eye-opener, Dr. Aatir, and I have got a set of questions for which we'll be needing a few more minutes.
Yes, sure, please.
Perfect. Dr. Aatir, Ms. Lala is asking, she wants to go through the research references which you have used. So is there any way that you share the references of this work with the participants?
Yes, I can share the references.
Perfect.
Afterwards, I will be share with you, or I will sending my email to the chat, and whoever mail me, I will send the detailed references to it.
Perfect. I'll be grateful if you can send to us as well, and then you can drop your email ID here in the chat room. Perfect. So Ms. Lala, you can see the email ID of Dr. Aatir is very much available here. Second question is from Mr. Sabir Nisar, and he's asking, should we focus on such disabilities while facing students' performance issues?
Yes. Well, there are what a person needs to do. A teacher needs to understand or follow the understand the pattern of mistakes that a child is doing. What a teacher can do, if the child is repeatedly failing in one domain, he or she can think of he can identify the pattern and matches it to the type of disorder that he or she most likely understand.
Perfect. And the last question is, executive functioning issues are only with the kids, or with adults, like at our age level, these can also happen?
Yes, it is very common. It is very common in adults as well. Executive functioning disturbances are mostly in adults, because in children, they are learning these abilities. They are not by birth. It is said that executive functions develop at the age of like 12 or 13. So before that, children, it is unwise to expect children would have strong executive functions. But it is issues which are more common in adolescents and adults.
All right, perfect. Thank you very much, Dr. Aatir. Please be in the acceptance of my warmest of appreciation for being so nifty and for being so on the dot. It was really worth attending session. May Allah Ta'ala bless you for distributing these chunks of knowledge in the society. Thank you very much.
Thank you. Thank you.
Ladies and gentlemen,